the hair. Everybody's in a better mood. So glad everybody's here today. First order of business we'll take care of are these citizen comments. Those that signed up. We'll have 3 minutes. And Bridget, will you watch the clock? Or?
I've got it somewhat.
Okay, you got it there, okay. And you've got 3 minutes, and we can't interact with you, but you can make your presentation. So if you would, consider Gutierrez.
Did I step up to the podium? Or
Please.
Yes, please use the podium and the microphone.
Good afternoon. My name is Isidro Gutierrez, citizen of Lubbock, lifelong, born and raised here. It's a privilege to be able to visit with you today for 3 minutes. I understand through some conversations with some very close friends that this board is taking under advisement the possibility of funding Planned Parenthood with tax dollars. And I'd like to visit with you for a minute on that topic. The very first thing that I'd like to say is that in the last Texas legislature, the majority of our representatives in Austin voted to disallow the use of tax dollars for Planned Parenthood. And I expect that at the local level, with there being closer ties with our elected officials, that taxpayer funding for Planned Parenthood would be a very interesting election year issue. And I hope that you would take that into advisement. I expect that our elected representatives here at City Council, who have the authority to approve or disapprove your recommendations, and who have sole authority in providing taxpayer dollars to an organization, would probably view this particular issue with disapproval. I think that the citizens of this community would take care to make sure that our elected representatives on the City Council understood that we do not approve of taxpayer money being used for funding of Planned Parenthood. Now, this organization is membership are honorable people. They're good people. I've known them. And their opinion is to be respected. But their opinion happens to be diametrically opposed to the opinion of many citizens in this community. And this particular organization, Planned Parenthood, is also a very polarizing type of an organization, because it is common knowledge, or well, it's assumed it's common, that our population is divided at about 50-50 on the topic of the services that this particular organization provides. I expect that in a community like Lubbock, that division is greater. It's probably more like 85% to 15%. Now, we believe that Planned Parenthood, as an organization, has a right to do whatever they want to do, but they should not be doing it with taxpayer dollars. If they want to fund abortions, if they want to provide mammograms, if they want to provide birth control or abortion pills, that's fine. Let them do it. We do not object to their right to do it. We do object to the use of taxpayer dollars for this.
Thank you, Mr. Gutierrez.
Time's up.
Time's up.
Mr. Chairman, I just wanted to reinforce for you guys that we currently have no funding that comes from the city, nor any of our grants that include any of the activities from that program.
Okay. Appreciate that, Mr. Snyder. Second citizen comments by Dorothy Boyette.
Thank you. Good afternoon, ladies and gentlemen. Thank you for this opportunity to speak to you. My name is Dorothy Boyette, RN. I'm a nurse at Covenant Hospital, but I'm here representing myself, and as a citizen, I'm from England originally. I've been here for 40 years in Texas, and I've lost most of my accent, they tell me. But I would like to speak against Planned Parenthood receiving taxpayer money. They currently have purchased a building on 67th Street at the cost of $200,000, which they paid for themselves, I assume. And they're currently running a money-making business over there at $500 termination. And so they should use the money that they're making as a business, and they're not paying taxes on that building because they have tax-exempt status. And I've checked that with the taxing people. So I think that if they're going to do anything, they should do it with their own funds and not with the taxpayer funds. Thank you very much.
Thank you, Ms. Boyette. And the third citizen comments, Steve Workman.
My name is Skeet Workman. I'm Vice President of the South Plains Eagle Forum and a longtime resident of Lubbock. And we were told that there would be discussion today on some funds going to Planned Parenthood. And you all have mentioned that might not be true, but I'm going to go ahead and speak up because I see a lot of doctors around the table. And we need your help to stop Planned Parenthoods and the abortions on 67th Street. I stood out on that sidewalk with Dorothy and talked to young women who walked in there and killed their babies. And it's a disgrace to my hometown, Lubbock, Texas, that this is going on. We would like you, if there's any possibility that they should ever get funds to put this on the agenda. More of us would like to come and speak to this. I brought a list of Dr. Brent Palger, surgeon here, sent a dermatologist, sent a list of his staff and his customers that would oppose this. I cannot believe that Lubbock, Texas has such an active abortion clinic funded and run by Planned Parenthood. And you all are our health department, so I just today would ask you to be cautious and not in any way use taxpayer money for this organization. I'm going to leave this list and y'all can just pass it around. Thank you.
It's not on the agenda, but I am curious, is anyone aware of this issue?
I have no idea. I don't think it's this body's position to fund Planned Parenthood.
We don't fund anything. I'm just curious about the position. And I appreciate y'all's comments and your interest, but I'm kind of lost as I'm trying to find out what's going on.
Well, we don't know either. We always take an opportunity to speak up.
Appreciate it. It's what citizens are supposed to do in their government.
You know, I'd recommend to you that sometimes when people say somebody said, you might want to ask in the future, who said it?
Well, I can't.
Anytime somebody says somebody said, but they don't say who, they ought to be telling who said it.
I can't ask the.
No, you can't.
I can't ask them, but I'm asking the board
future.
if anybody knows where this issue come from. I'd appreciate more insight to it. Dr. May?
Scott, you mentioned that you weren't aware of anything being before city council at this time.
Well, there's currently no funding.
No, there's no funding that we
There's
have.
no funding. The city council has not funded anything except what you're already aware of.
Right.
And it includes no funds whatsoever to deliver any of those programs, nor do the grants that we receive through the state. So
We're not on the agenda. Anyway,
where that comes from. So.
We're not on the agenda. It's not posted anyway.
Okay. We can talk about it later.
Yep.
Appreciate that. We are going to move fast today because we will adjourn at 1:30, so we're going to try to get through all of this quickly. An update on the city-county health committee health, the Department of Health investigation. The committee, the City Council asked me to put together. Probably at our last meeting, we were unable to have a meeting on Valentine's Day as we were fearful of our spouses. But, our next meeting will be this coming Tuesday in 103 at City Hall, 5:15 p.m. At our January the 31st meeting, what we're trying to get our hands on, and Dr. Carr, please weigh in as you feel the urge. We're trying to identify the problem. What are we trying to fix? Are we going to fix it till it's broke? That's my concern. And so we're trying to identify what the advantages, it's basically a cost-benefit analysis of forming this joint health department. What would be gained and what would the cost be? And we haven't gotten to the cost yet because we're trying to identify how it would improve services. And there's some great ideas on the table that have been discussed, but that's really the topic that we're wrestling with the most. We've discussed issues like justifying or the feasibility if we considered the county's input to be really a match in kind, like for their indigent care clinics and the county hospital, things like that. But we haven't, I think we're all wrestling with it. Is that fair, Dr. Carr?
Yeah.
And along those lines, I've been asked to present our findings thus far, or a status update to the City Council at the next council meeting. And I will basically repeat this to them, but I'm also going to add, and I'm going to throw it in at this time, a request that with recent newspaper articles and reports that are out, I'm going to ask that the City Council please not consider any further cuts to health services in the health department. And that I will be speaking on behalf of the board, so that I bring it to y'all, and so y'all will know that I am going to make that request. Everybody good with that?
Yes. Yes.
All right. Well, that's really short and sweet as far as where the county, city-county health department is going. Communicable disease report, Becky Brawley.
Okay, you have there in your packet a summary of our communicable diseases. And in January, as are most months, the most diseases we saw were enteric, with shigellosis still the main enteric disease we see, with 19 cases and we expect over a 30-day period to have fewer than 9 cases, and that has not been the case for a couple of years. We do a lot of teaching. We've had 4 small cluster outbreaks at schools and daycare centers. So we do a lot of education, a lot of teaching. We send brochures, and we interview every case that we have that is confirmed. We are still seeing invasive streptococcus pneumoniae. We had 7 cases this month, and that is less than what we have been having. Our team does a good job interviewing all these cases, and just so you all know that the cases that are listed on your report, and I did just a current on the back, it's just the months, are City of Lubbock cases. Our county cases other than sexually transmitted disease and tuberculosis are now not on this report because the State Health Department has taken over investigation of county cases. So we are only doing City of Lubbock. Any questions?
Where are we seeing these enteric, particularly Shigella? Are we seeing this in the pre-teenage population, or is this across the board?
Daycare, toddlers, diaper babies, and as well as kindergarten, first grade. They all love each other so much.
Any adult cases, or are they all?
There are sporadic adult, especially in the daycare centers where they are taking care of the diapered infants. We do see some there as well, but mostly children.
Can I ask a question?
Sure, certainly.
Just this sort of peripheral a little bit. There was just a report, not here in Lubbock, but of a case of a death from a dental water line.
From a what?
Dental water line. Does anyone have anything to do with surveying dental water lines or anything like that. Water lines were going to cuts, water from going to cuts from people's mouths.
For biofilms.
Yeah,
Yeah.
it was a Legionnaires that killed the patient.
If it was a Legionnaires and was reported to us, yes, we would investigate it,
But there is no standard set.
not that we do, not that I know of. Do you know of, Jim?
Thank you.
Thank you for your report, Ms. Brawley.
You're welcome.
Also, it's not on here, but is MRSA reportable?
No, sir, it's not yet.
Because I've observed, 3 people that I know real well in the past week and a half diagnosed with MRSA.
Yes.
And I don't know if it's a climate or because of the weather or what's going on, but it just seems like a cluster.
They are starting to do some studies on requiring that MRSA become a notifiable condition, and they're studying that in Austin, that as well as Australia and Dickinson. So those may be something that might be on our notifiable conditions list next year, but they're not this year.
Are y'all seeing an increase at any of the hospitals or clinics? Anybody know of?
Most individuals that work in the healthcare system are probably colonized with MRSA.
Right.
I probably have it, but why does it affect somebody but not other people? It's an invasive bug. You have to have certain scenarios.
I just thought it was interesting to know that many people within a week.
It's been rampant for the last several years.
Or at least
It's
5.
not new. And the C. diff is sort of the same thing. You see lots of C. diff in nursing homes, institutionalized individuals in hospitals.
Any other questions for Ms. Brawley? Thank you again. And we have a new person on board, Ms. Falkenberry.
Yes, I'd like to introduce to the board our newest vector control supervisor, Glenn Heinrich. Did you want to come and tell us your experience and a little bit about yourself? He comes to us from Texas Tech, and he's an entomologist.
Good afternoon. My name's Glenn Heinrich. I'm originally from Slayton, Texas. I'm born and raised there, lived there all my life. My specialty, I graduated in entomology from Texas Tech in 1979. Went back into private business and private farming and did my career there. And I'm still active in that today. About 10 years ago, farming got a little tough. Went to town and got a job. I've been, the last 6 years, I've been out at Texas Tech, out in the grounds maintenance department, taking care of all the landscape there on the Texas Tech campus. And just here in the last couple of weeks, I was hired as vector control coordinator. I'm privileged to be here. I know I've got some large shoes to fill, and hopefully I can make a difference in our mosquito program here at Lubbock. I know they're a big nuisance and can be a health problem, and there's probably no way that we can totally eliminate all of our problems. The weather seems to do a good job on that, but I know I'll be working closely with this board and all the citizens of Lubbock, and if there's anything we can do or I can do as a coordinator, I'm glad to help out. I'm just glad to be here.
Thank you, Mr. Heinrich. Welcome to Hopefully, you'll get a chance to really practice your craft this spring with a lot of rain and a lot of mosquitoes. Mr. D'Souza from the Nurturing Center. Do you have everything you need as far as
Yes,
set
I
up?
think I'll have my assistant run a slide show presentation as part of my presentation. And I'll keep it short. I can go on for an hour on the subject, my favorite subject. But first of all, thank you for giving me an opportunity to talk about this. My name is Lawrence D'Souza, and I am the volunteer founder and executive director of the Nurturing Center. The Nurturing Center is an independent 501c3 nonprofit organization serving Lubbock and the surrounding area. Our mission is twofold. We offer unique, individually tailored, compassionate assistance to women facing unplanned pregnancies. We offer free ultrasound, guidance and options, counseling, referrals to adoption agency, infant care supplies to promote the sanctity of human life. All of our services are at no cost to the client. In some cases, financial help is available to qualified clients. Secondly, and more importantly, as we all know, prevention is better than intervention. We offer chastity education to teenagers not only to prevent unplanned teen pregnancies, but to teach them to embrace the forgotten virtues, modesty, chastity, and purity. Our feedback from the retreats we have conducted proves our objective is working. We had one compliment from a teenager who said, "Thank you for educating me. I now look at girls differently." We have inspired over 2,500 teenagers to commit to purity, and that's the success. Prevention is better than intervention. Now I'll go on to another subject, and that is the pandemic rate of STDs. According to the Center for Disease Control, epidemics and pandemics refer to the number and geographical spread of infectious diseases. Young people represent 25% of the sexually experienced population in the United States, but account for half of all new STD transmission. HIV/AIDS has reached pandemic rates as they have caused nearly 30 million deaths worldwide. The CDC reported, and this is data that can be picked up and verified, and I can give you references to this. For the year 2010, in the United States, there are 19 million new infections every year. Cases of chlamydia have risen 24% since 2006. Cases of syphilis have risen by 36% since 2006. Did you know 8,000 teens contract an STD every single day in the United States? Now let's do the math. That is virtually 2.9 million infections. Most of these viral transmissions are life-threatening, as you all know, most of you know, there is no cure. Recently, this has reached pandemic proportion, and we stand to lose the next generation to the AIDS epidemic. Each year, untreated STDs cause at least 24,000 women in the United States to become infertile. Studies suggest that people with gonorrhea, chlamydia, or syphilis are at very high risk for HIV. Untreated syphilis can lead to serious long-term complications, including brain, cardiovascular, and organ damage. Now, we put together a chart that was put out by the former Surgeon General, Everett Koop. When the chart reveals when you have sex with someone, you are, in fact, having sex with everyone that person has had sex with for the last 10 years, and everyone they and their partners have had sex with for the last 10 years. Because in most cases, or in some cases, that virus does not, or the symptoms do not manifest themselves and can retain for up to 10 years, and the individual may not know. The effectiveness of condoms in preventing STDs depends on consistent and proper use. Consistent condom use is reported by less than half of all sexually active adolescents, which indicates that condoms cannot be 100% effective in preventing STDs. Second, pregnancy prevention is not disease prevention. This is given, most of our teenagers are being given a false sense of security of using what is called the safer sex ideology. A possible solution: abstinence-only based programs teach a 100% effective method to prevent STDs. The results of a 2010 study tested a theory-based abstinence-only education. 32.6% that had received the abstinence intervention initiated sex. And I'm talking about teenagers, unmarried. 51% that received safer sex intervention initiated sex. 41.8% that received comprehensive sex education initiated sex. And 46% of the control group initiated sex. What do parents think about it? What do parents want to secure the dreams, the hopes, and aspirations of our young people? The National Abstinence Education Foundation polled parents in 2007 and found that 9 out of 10 parents agreed that being sexually abstinent is best for the child's health and future. At least 8 in 10 parents support the overall approach of abstinence-centered education. In concluding, protecting citizens from infections and disease must be the goal of public health. I share with you the goals of what we need to do. We know from experience what isn't working, so I ask you to try something that we know will work. Let's take the issue of preventing lung cancer. You don't give somebody a safe cigarette to prevent lung cancer. Similarly to drug addiction, you don't give somebody a safer drug to prevent the narcotic addiction. I want to conclude that this presentation was viewed by and endorsed by Dr. Benny Phillips. Now, Dr. Benny Phillips is an gynecological oncologist in Lubbock, and he serves on the board of the Nurturing Center. So that's to verify all of the statistical and data that I've presented to you. Thank you. What I'd like to do is partner with this board to make a difference to save our next generation, because I am deeply concerned about what's happening to our next generation. Thank you very much.
Thank you, Mr. D'Souza. If you'll stay there, maybe questions from the board.
Asking what the PWS for Benny Phillips endorsement. How that translates.
I don't have time to answer any particular questions now, but I'll be happy to wait and deal with those questions individually, if that's okay, because my time was limited.
No, your question answering time is not limited. Or do you have to leave?
Yes.
You have to leave?
Well, after a little while, but...
Okay, if you could take a few questions, I'd appreciate it.
Thank you for your presentation. Can you tell me if you have any studies on the results of the Nurturing Center's methods, whether you have done any statistics on whether, in fact, using your methods or through your center has succeeded in lowering the rates of sexually transmitted diseases or teen pregnancy?
We have not kept statistical data, but we have made presentations to more than 2,500 youth since I started this in 1996. And we have presented and we have provided assistance to more than 400 mothers to nurture and cherish the babies in the womb and to give life.
Any other questions? Dr. May?
Doctor, thank you very much for your presentation. And you mentioned working with us, co-opting with us to prevent these problems, which I think is a very good idea. How would you and Dr. Phillips and the others on your board propose that we work together with the Lubbock Board of Health, with the City Council, with the City of Lubbock? How would you see that fitting together in short term, long term? Where do we go from here?
We have put together a team that advocates the chastity education. We embrace and educate our young people on a curriculum that was designed and put together by Pope John Paul, the late Pope John Paul. It's called the Theology of the Body for Teenagers. We've had about 5 or 6 retreats recently and have had very good results with them. Because one of the, what I'd like to do is partner with this board to get access to the youth and maybe the public school system or other organizations that do what we like to do. We are funded entirely by private and corporate donations. We have an annual fundraising banquet that is responsible for the bulk of our fundraising. Our budget constraints are pretty short, but we do what we can with the little that we do.
Dr. D'Souza, would you and Dr. Phillips and others on your board put together a proposal and then come back to the board and present your proposal to us so we could have some meaningful discussion going forward?
Yeah, I would love to do that if you can again.
Free.
Does your program educate, as part of the education program, do you tell young people that condoms do not work?
He asked if you tell the youth that condoms do not work.
Yeah, we educate them on what works, what doesn't work, and the failure rate. 17%, 17 to 20%, that's the CDC statistical data. Condoms fail 17 to 20%. Now think about it. That's 1 in 6. Isn't that playing Russian roulette with the lives of our children and our youth?
Yes, but using the same statistics that you just presented, 2 out of 3 young people educated in your program, or at least this program of abstinence, don't fail also.
So what is the question?
So I'm just trying to compare these two. Why you're talking about failure rates?
Can I interrupt real quick? He's having trouble hearing you. If you could just get a little bit closer to your microphone. I'm sorry. You can hear him? No. Do you want to go over there too then maybe?
That's good enough.
I won't be able to record it exactly.
That's okay.
Other questions? Dr. Mayer, are you going to follow up?
I'll make one other comment. What Dr. Souza says is if you go to the CDC website, CDC says exactly the same thing Dr. Souza says, that abstinence is the only means of totally or completely preventing sexually transmitted diseases.
Well, that's true, but I'm talking about the program. An abstinence training program only has a 2/3 success rate, which means 34%, as you said, fail.
Thank you, Mr. D'Souza.
I would, by the way, I am making a copy of this presentation to each and every one of the board members here, and there are references of where this data come from. Okay?
Thank you.
So,
appreciate it.
If you would pass that.
Immunization policy changes. Welcome, Barry.
Thank you. This is a carryover from last minute when we did not have time to get to this subject. So it's been in effect for a while. But on December 20th of 2011, we were notified that there was going to be a policy change that came through the Department of State Health Services, and this regarded insurance eligibility, well, not eligibility, but insurance that the clients have. So I wanted to kind of brief you on what the policy is. It is a change in response to reductions in state and federal immunization funds, increased federal accountability for vaccines, and increase in prices for some vaccines. Children who have private insurance that covers vaccines will no longer be eligible for the Texas Vaccines for Children program vaccines in public health departments statewide. They will be referred to their medical home. Now, we have always done this here at the Lubbock Health Department. If children were insured, we did refer them to their medical home because that is what the grant wants us to do. But now I guess it's a stronger requirement. This policy redefines the meaning of underinsured, and it is now defined as a child who has private health insurance, but the coverage does not include vaccines, or a child who has health coverage that only covers certain vaccines. And in that case, they would be able to receive TVFC vaccines as long as they were not covered under their insurance. Or they have insurance that caps vaccine coverage at a certain amount, and once that amount is reached, they would be eligible. There is a flow chart included in your packet, and this is what our staff uses to determine if someone is eligible for TVFC vaccines here at the health department or not. Children have to meet certain criteria in order to be eligible to receive, and I wanted to let you know that Medicaid and CHIP, and those are still accepted here. We're talking about private insurance. So the main change is that the definition of underinsured has changed. As far as adult safety net vaccines, the primary change in that program is the kind of, or the number of vaccines and the kind that are available. And available vaccines through the adult safety net program include hepatitis B, MMR, measles, mumps, rubella, tetanus, diphtheria, and acellular pertussis, and tetanus diphtheria. The eligibility criteria for adult safety net is people that have no health insurance, people that are 19 years of age and have been referred to the public health department to finish a vaccine series that began when they were 18 or younger. And I just wanted to, for comparison purposes, before this policy took effect, underinsured, the definition used to include people who had a high deductible or couldn't afford their copay. And this eligibility is self-declared by the clients. If they tell us, as you can see on the flow chart, that if they say they don't know if they have health insurance or not, we ask them to call their insurance company and verify that. This took effect January 1st. It's gone pretty smoothly so far, but I think it's a symptom of a trend that you're going to see happening more and more. There's just going to be more accountability for vaccines that there is no charge for.
And along those lines, we see it's been stated several times, a trend towards decreasing immunization funding and grants from the state and from CDC all the way down the line.
I can't really speak to an increase or decrease in funding, but I think service delivery is going to be discouraged further down the line.
Other questions?
Well, a question I have is, now it's my understanding that to house, like if a physician offers immunizations out of their office, that there are guidelines as to a separate refrigerator, contingency, emergency management to keep temperatures down or whatever. And so, I mean, I know, for example, that the two family practice doctors in practice with me, neither of them do immunizations. They tell them to come down here because it's not practical for them to keep it in their office. Any idea about, so if they're referred to, because it says you're referred to a private physician's office, any idea how many private physician's offices in this town meet that standard that would actually provide it?
Well, all the TVFC providers have to meet that standard because that's part of what we do here at the health department is make sure that they do meet the standard.
And how many are those? Are there of those?
How many TVFC? 42.
42.
Providers.
Okay.
Also, I forgot to tell you that DSHS sent a blast fax to all private physicians that is letting them know of this new policy as well.
So the policy would be, for example, then if say, one of my family practice doctors, that they should tell the person that I'm not going to do this, and then they have a list of here's 42 places that you can go to get that immunization.
Yes, that's what we do when we refer people to their medical home. A lot of times it's not a private physician, but it can be.
Mm-hmm. But those private physicians, like my two partners, have a list of the 42 people that have immunizations available that they can send their patients to?
Sure, they can.
Okay. All right.
If,
Do they have a list?
oh, do private physicians, I'm not sure. Becky, do private physicians have a list of the TVFC providers?
No, probably not all of them, no.
So they would direct them down here, and then you guys would have to tell them, here's 42 people that do what your doctor doesn't do.
Well, if we're a TVFC provider here, if we can't see them, I mean, we're not going to send them to another TVFC provider. If they have insurance, we're going to send them to their medical home.
But
Which means
if their medical home doesn't provide that service, I mean, I guess I'm
the
confused.
Texas vaccine for children?
Well, like if Dr. Chris Rose doesn't provide that service and he's their medical home.
Oh, then we would
Well-
need to refer them to someone that we know provides immunization.
Right. So he would refer them here, and then you guys would refer them somewhere else.
Yes.
Okay.
Just for clarification, so you cannot charge bill insurance company?
Well,
You're
No, she said
blocked.
Medicaid and
Yeah.
CHIP that they're doing.
we are not billing insurance currently, no.
You cannot. I know you may not at the moment, but can you? Are you blocked from billing?
No, there is nothing that prevents us from doing that
So if
except
you wanted
staff
to-
and funding.
So if you wanted to, you could actually bill an
If we
insurance
have
company?
staff to do that,
Okay.
and funding.
By doing so, you have to be a preferred provider and all that, you have to sign up with the
You'd have to
different
be approved
insurances.
by the insurance
And
company.
it, and it may require changing the PCP to somebody else, to the medical student, so it's,
More hassle than just.
Yeah.
there's more to it than just.
Well, everything's a
But-
hassle in
but-
medical care nowadays. So.
We would have to purchase the vaccines, though, that we gave to people who had insurance.
Who,
Those are not the free
Yeah.
vaccines.
okay, the TVFC vaccines, those are provided by the state.
Yes.
Through designated providers, of which the health department is one. And there's no charge for these, and you collect an administration fee.
Correct.
Do you give any other vaccines that aren't funded by the state in this way that you could potentially bill an insurance company for?
Well, we do have private pay vaccine that we do charge for now.
You do
We
charge.
could bill for those if we had the staff.
Any proposal that would come from this particular issue, of course, is going to have to be cost efficient.
Right.
Right.
We're just
I
investing.
understand on both sides.
Just asking a question.
I
Okay,
understand,
so
but
Medicaid-
I want to make sure that
We understand that.
don't
but
forget
we
the
know the
cost.
city's not going to do a damn thing if they don't get their money.
Well, you got to cover
Well,
the cost, or it
and-
has to come from somewhere.
We know that.
The role of the health department has always been a safety net role. We don't really feel that we can compete with private physicians and FQHCs in providing services and billing insurance. To us, that would be the same as being a private doctor's office.
No, it's not. It's really not. What we're talking about is providing health care to a group of people that may have trouble reaching their private physician or other things as a service. That's what we're really talking about. We're not going into competition.
All right, we're going, unless there's a burning question, we're going to keep moving. Thank you, Bridget. Report, the plans to administer the second dose of Hep A vaccine.
That's me again.
Yes, ma'am.
We are planning to hold the second Hep A clinic April 3rd from 11 a.m. to 6 p.m. and April 5th from 9 a.m. to 3 p.m. We cannot start the Hep A clinics until after March 23rd because after the clinics at the Civic Center, we actually saw some of those people who were exposed in the health department clinics. We gave about 2,700 doses, and we have 1,600 now. And so what we are going to do is we're going to notify the people that came to the first clinic by letter, and we're going to, there's a copy of the letter in your packet, by the way. And we're going to invite them to come back on those 2 days to receive the second dose. Since it is not required, but it is better to have lifelong protection. We hope that those people will come, but, you know, of course, if they're not required to. Therefore, we're going to charge $15 per vaccine to try to recover some of our costs. We will handle it like we do flu shot clinics. We're very good at that. We all have done it many times before. We have 7 nurses that are going to be giving shots. And if we do not use all of the doses at that time, the vaccine doesn't expire until 2013 and some in 2014. So we'll be able to use those in our regular clinics. Any questions about that? Yes, Dr.
You said you're paying you're charging $15 administration fee for these?
Yes.
Will that help you recoup all your costs?
It will help. It will not recoup all our costs.
And from that incidence of Hep A in the restaurant, were any cases ever forthcoming out of that?
No, sir.
I didn't think there were. So
And that's a good thing.
you guys did a good job.
Thank you. I think the original cost of the vaccine was $27.
For us?
Uh-huh.
I think it was 27. I'd have to look.
Approximately.
That's pretty close.
Yeah. That was the cost of the initial dose. So we will not recover all our costs.
What you're doing is working. Thank you.
Thank you.
And I didn't read the letter real close, but they're going to get back with you. They're going to reply if they're planning on coming. So you can plan on how many. You know, you don't want to have 1,600 doses on hand and 30 or 2,700 show up.
Well, we already have the 16 left over from the first vaccination clinic. And so what we don't use will be used in the regular clinic.
Okay.
And we are going to require them to bring the letter with them. And if they don't have it, we can still look in the computer to verify that they got the first dose.
Thank you very much.
Thank you.
I'm going to suspend the work session just for a moment and go and take care of the 2 action items before we adjourn at 1:30, and maybe we'll get back to the discussion. Dr. Carr, please.
Sure.
Do I hear a motion to approve the minutes?
So moved.
Moved. Seconded by Patty. All in favor?
Aye.
They're approved. We tabled the motion, Dr. Carr's proposed amendment. I guess we discussed it at the last one, or did we table it out?
We tabled it, but then Judge Medina and I have gone over some of the language, and this is sort of the...
If you'd like to introduce that again and go through it.
Okay. Just very quickly, that the whole idea was that we're making some changes to the bylaws.
Now,
that,
can I interrupt?
Go ahead,
Since
Judge.
it was tabled, I'm assuming that somebody's calling that it be put back for discussion by...
Right.
But it's on the agenda, but you haven't officially voted to discuss it.
Okay.
So somebody makes a motion.
So-called.
Bring it back.
Been moved and seconded that the motion be brought back on in front of the board for discussion. All in favor?
Aye.
Opposed?
And so now the main change is it just changes it from the chair being able to appoint committees to the board appointing those committees. And then, as Judge Medina pointed out, concerning if we have the chair be the ex officio member of all these committees, it could really put a damper on his dance card. So we talked about adding the language of the chair or the chair's designee can be the ex officio of all committees, so that it gives the chair flexibility as to whether or not he attends. Judge, do you have anything else that you want to add to?
Yeah, you might want to consider too that, remember, this is, according to this amendment, it's still the council, city council, that would give approval to whether there's a subcommittee or not. And the council could very well add other things to that. Council could say, well, no, I know y'all want a committee of 5, but we'll allow a committee of 3. Or you want a committee of 3? No, we want 5. The council still has the right to approve a committee. And in order, they could say, well, no, unless you have this much, or unless, and we want this person to be the chair, or we want, they still have a lot of discretion. I just want to make sure that y'all know that going into this. Council does not lose its authority by charter and by ordinance to do, or, to either approve, or to add, or to do whatever they feel necessary.
quick question. Do other boards also have all their subcommittees subject to?
There's
the
different
approval of the
different
council?
boards. You have, your bylaws may be different than one of 55 others. So, you know, it would depend on which board you're talking about. Some are officer of the city boards, some are not. This is not. This is an advisory board. Others are officer of the city that can bind the city to something.
But
They have other
but the language of saying after private approval by the city council
Right.
kind of
takes care of that.
shows the respective, they get to.
Exactly, Dr. I just want the board to know ahead of time some of those possibilities before they vote on it, because I would hate for you to go into something and say, well, we have a bylaw by God and this is the way it's going to be. Well, no, it's approval of your city council. And don't want you thinking that let me say it another way. A bylaw of this committee or this board doesn't trump policies and procedures, doesn't trump ordinances, and it does not trump the city charter. And so I want you to know ahead of time. This is for your own edification, if you will.
So the board may appoint someone, appoint the chair of the Board of Health
They have
to
a
not
right.
be an ex officio member of the
They can
committee,
say
correct?
that or not say, they can approve or not approve. I mean, you go to the board and say, here's to the council, and you say the board is, and probably through your chair, whoever the chair is, and they go and say, we are asking to have a committee. And they may say, okay, a subcommittee. They may say, all right, we'll approve subcommittee of this many people. And once you tell them who it is, they say, okay, well, they could say, I'm not saying they're going to do this. I'm telling you that they could say that. They could say, well, we'll appoint this person as the chair. I don't know what they'll do. You may go in and say, we are recommending a committee of 3 people and the following people. They may say, okay. You know, I don't know what they'll do. You just need to know that they have that broad discretion. And again, I don't pretend to speak for the council as to what they're going to do. I can tell you that they have that authority and that right. They're your elected officials. And by charter and ordinance, they have that duty. They have a duty. In fact, there's an ordinance that says that, and the charter says that they can have a committee, a board or not have a board. They can vote a board out. I mean, and say, we don't want a board anymore. We don't need this board. Unless it's written by statute. So you just need to know what it is. And again, I don't pretend to tell you what a council will do. I have no idea. You just need to know that those are possibilities.
Thank you, Judge.
Information.
No, it's brought back on the table for discussion. So further, I've got a lot of questions myself, but go ahead, Dr. May.
I'll address this to Sam Medina. Sam, I'm really confused with what's being proposed here. Is this proposal stating that power is taken from the chair of the Board of Health and given to the board so that the chair, Dr. Presley, who's sitting in that chair now, can no longer appoint committees, that we have to appoint them as a group or as a body of the whole?
All I'm telling you is what it says there. It says that the board, it used to be the chair, now it's the board, after prior approval of city council, like it says there, may appoint.
This sheet that's in your packet, I'm sorry, Judge, is the original wording.
Is it in our pack?
Yes.
Yes. And then on the agenda is the proposed wording.
The one in green is the one that's right now that you have now. It's highlighted in green, I guess, right?
Yes.
And then this is being what's being discussed now. And I'm assuming that there's a motion to change it.
Yes.
Originally there was that motion, and now it's for discussion to change what's in green to what you now have in your handout here. And the difference in the two of them is where it says the chair after prior approval, it now says the board after prior approval. And then at the very bottom, it says where the chair shall be an ex officio member